everyone. So we're extremely excited today to be talking about how we can fix our hips at home. So I know a lot of us have really been starting to feel the brunt of these last couple of weeks. We're finally starting to hopefully get into a routine, finally starting to figure out what this new normal looks like. But the reality is we also are probably starting to feel kind of stiff, not as many exercise options, and, just sitting at a makeshift ergonomic workstation for those of you who are still working corporate jobs. So listen, we get it. And we're excited. So today I am super excited to introduce our speakers today. So our lead presenter today is Amanda Lee. She is a registered physiotherapist with a very strong interest and expertise in sports orthopedic practicing. She practices using, her practice is comprised, her practice is comprised mainly of sports and orthopedics. And we also have a featured physician on our panel today as well, Dr. Braden Gravelle. So he is a family doctor with us at Integra Health Center and has also a very strong background and interest in sports medicine. So are you guys there? Let's see your pretty faces and let's get to it. How are you guys today? Hi, Amanda. How are you? Hello. Hi, Amanda. Can you hear me? Oh, we're having some technical glitches, guys. Dr. Gravelle, are you there?
I'm here. For some reason, my video is not showing up.
Oh, guys, we're all having technical difficulty. That's okay. That's why we have Jocelyn here. Jocelyn can kind of figure it out on the back end. Jocelyn's my techie. So if we can sort of figure out how to get both of you guys on here. It worked for us yesterday, so we'll get it to work.
Can everyone hear me?
We can hear you now, Amanda. How are you?
I'll just take my AirPods out. I'm good.
I know sometimes the AirPods, they work for us, and then sometimes they just decide not to. And so I've gone old school. I've got like the full wired plug-in option here, but I know for today you're going to be moving around a lot. So all good. We can hear you, and if we can't, we'll let you know. Dr. Gravelle, are you having any success?
Jocelyn's trying to get me on video. I don't know what's going on. This worked yesterday, no problem.
I know. That's okay. Well, listen, hey, how about while we're getting everyone, is something covering your camera possibly?
No.
And you've clicked the start video option?
Yeah, let's see. Yeah, it's a blank screen for me right now, but go ahead and get started, guys. I'll message Jocelyn here so I can get
another thing that you can do, Dr. Gravelle, too, is you can probably just like log out and log back in. Sometimes that does the trick for some of us.
All right, sounds good.
Who have been on these Zoom chats. So Dr. Gravelle will join us in just a few, and when he does, we will make sure he gets the introduction that he deserves. And in the meantime, we won't get you guys waiting too long. So hip assessment and mobility, Amanda, this is like a pretty, common issue. You see it in your practice quite often. I mean, like, how many issues do you see in your practice? Like whether it's like low back or knee or anything like that, like how often do you end up finding that they turn into, a hip issue, or that they actually are an underlying hip issue in your practice?
I would say like at least 50% of the time.
Wow. Wow.
And even if it's not a hip issue, it could be a shoulder, and then we still end up looking at their hip and kind of figuring out things there and just adding that into their program anyways, because like we'll get into later, like just how important it is to have healthy hips.
Mm-hmm. It's kind of like that song, right? Like the hip bone's connected to the knee bone. Like everything in our body is connected. And I mean, we've all kind of at some point in one of our webinars talked about, just the fact that like, even if you have neck pain or jaw pain, before people used to think we were crazy when we would say things like, well, we should also check your knee and your hip. But now it's not so crazy anymore because everything works together. Our fascia is just one big interconnected web, right?
So yeah, before we sort of get into the presentation, just wanted to talk a little bit about mobility versus flexibility. I think sometimes we use those interchangeably, but just to give everyone sort of the education, let you know how different that they really are. So when we think about flexibility, we think just holding a stretch, or as a therapist, holding someone's stretching someone's hamstring in that way. And this is not clear.
There's some voice volume issues on your end. Guys, we're just having all sorts of technical glitches today. Sorry.
Can you guys hear me now?
I can hear you.
Yeah, I can hear you as well. Again, my
Okay.
video is still not working, but
Well, that's okay. At least we can hear you. We
Yeah.
can hear you, Dr. Gravelle. So we'll just have to listen to your voice and trust everything that you say without any facial expression, okay?
Sounds good.
Yeah, so getting back into it. So flexibility is something that we do passively. There's not a whole ton of movement there. We're stretching one side of the muscle, and that of course has its benefits to it. But again, with our lives, with what we're doing day to day, we're always moving. So we want to make sure that that's translating to our body. So that's where mobility comes in. And a lot of what I'm going to be talking about today comes from something called FRC, or functional range conditioning. And the way we look at mobility there is actually through strength and control of the joint through its full range of motion. So that big strength aspect of our joints is where the difference comes between flexibility and mobility. So if we kind of jump to the agenda that we're going to have today, going to be talking about, again, the importance of our hip mobility, how we can assess that at home, and then lastly, just getting into the ways that we improve that. So then, again, getting into the importance of hip mobility with this picture that I'm going to show you on the next slide. Okay, so like Sapna talked about before, a lot of the times people have all these other areas that are affected because of our hips. And so we know that if we're just having a hip problem, it's not just going to be our hips that hurt. And so that's, by this picture, we have something called lower cross syndrome. And it's, patient after patient, that's what we see is how they're presenting when they have tight hips. And usually that's what it is really tight hip flexors. So because we sit all day, it kind of puts those muscles in a short position. And so when something's short on one side, it ends up being long on the other, which sometimes means that there's some weakness there. And so with this picture, what we see is when our hip flexors are tight, on the opposite side of that, where our glutes are, those can, be in a longer position, those can start to get weak. And then on the upper side of that, when our hip flexors are tight, it puts our back into a little bit more of an arch, which is what we call an anterior pelvic tilt or lordosis. And then that just causes so much more work for our lower back. So that starts to get really tight. And then on the opposite side, the front of the body, our core, our abs, those end up getting lengthened, and then those can get weak over time. So sort of day by day, you might not really see any changes. You might not really have pain, but over time, as this sort of keeps building up and you're not addressing it, you start going to the gym, lifting weights, just doing things in this not ideal alignment or position. And then that's when, injuries happen. So I see so many times it's the low back that ends up, having to compensate and get injured. But then also in the hips, also in the knees. And it's kind of just can affect everywhere when this starts to happen with our hips.
Absolutely. So Dr. Gravelle, unfortunately, we can't see your face, but like I had earlier mentioned, welcome. Thank you for being here.
No
you have, you see quite a lot of sports cases in your office. And I know, what are your thoughts right now? I know a lot of people right now are either using their time right now effectively to start working out again, but then there's others who have just completely become sedentary because they rely so much on being out and about. So what would you sort of say about all this right now in your practice?
Yeah, I kind of agree with what you're saying, and Amanda was kind of alluding to this as well, especially right now. So first, I kind of have two categories. One, those that are just starting out or have just picked up a new exercise or wanting to kind of get back into shape, which is obviously the way to go. But what tends to happen, we focus on kind of one side and not kind of both sides. If we're talking about the hip, so working on quads but not hamstrings, things like that, those can all kind of result in that imbalance that Amanda was talking about. And so, yeah, it's always important to, yes, strengthen both sides, but then also we're talking about stretching and kind of keeping kind of the mobility aspect of things as well. That's another one that I see probably the most often, is that people just don't take the time to stretch things out. You then have problems in the hips, which then translates one joint above, one joint below, being the knees below, and then the lower back or SI joint above there. So those are that's that one group. The second group I would say that's probably we're going to see a lot of as well is those that are the sedentary group, sitting around too much, either sitting at improper desks. So a lot of us are making our kitchen tables our new desks. So that's going to result in some problems depending on how long this goes on for. So we need movement, definitely. Just kind of agreeing with Amanda's going to go through this in a second here, but just kind of the different movements are very important, because those joints that we have produce their own natural synovial fluid, and if we don't have movement in them, we don't get that nice fluid secretion. So
it's like the move it or lose it.
Exactly. That's totally it. I say that to my patients a lot.
All right.
All right, so getting into a little bit more of the active stuff that we're going to do. So if you aren't on a yoga mat or don't have a yoga mat or a carpet or a towel, go run and grab one of those. If you have a yoga block too.
I forgot to prompt that to everybody. I'm so sorry.
If you have a yoga block handy, get that. And then, or also just like a towel that you can roll so that it's something pretty thick. And I'll just let you guys run and grab that for a minute.
What are you using today, Amanda?
I have a yoga block.
Oh, perfect. Perfect. Yeah, I think now more than ever, even with Amanda and I, like, we're so used to spending the majority of our day, even Dr. Gravelle, like, I mean, we're always on our feet with patients. And so this whole new life of like telehealth and, you know, rehab virtual and sitting at our computer all day long, I completely empathize now. I don't know about you two, but I completely empathize now with our demographic of patients. I used to remember it as a student, but I completely forgot. Like, I've been in practice for so long that now I'm like, my God, my whole body hurts. And I'm like, I take every single, like, as soon as, you know, these webinars get started, I like actually go and do these movements after, because it's just a way for me to force myself to start, you know, moving again. Anyways, everyone should hopefully have their towel or yoga block or something. So let's take it away.
Okay. So just to quickly go through these, the names of these ranges of motion, just so you guys are all familiar. So hip flexion, as you can see in the picture, is when we bring our knee into our chest. Hip extension would be like lying on your stomach, lifting your leg straight back. Hip abduction is going to be bringing your leg out to the side. Hip adduction is going to be bringing it in. And then the internal external rotations, where it gets a little complicated because what's happening at the hip is different than what's happening at the leg. So when we bring our leg inwards, that's actually external rotation at the hip. When we bring our leg out, that's actually internal rotation at the hip. So in the picture here, it gives you sort of what the ideal range of motion is. A lot of the times people are a little bit under where we would like them to be. And then obviously, you know, if you're dancer, gymnastics, a lot of the times those ranges of motions are a lot higher. But we're just going to get into how we can look at how these motions are. So we'll first get you guys lying on your back, and we're going to check out hip flexion first. So all you're going to do is try and bring your knee without your hands. Try to bring your knee close to your chest. So being right here would be about 90 degrees. We expect sort of 110 to 130. So again, if there's a lot of tightness in the hip, you might not be able to come, you know, all the way to that kind of 110, 130 degrees. So that's going to be on our right leg, and then just sort of seeing where you are. A lot of the times, you know, one leg does better than the other with most people. So that is going to be our hip flexion. If you roll onto your side, we can take a look at hip abduction. So again, just trying to keep both hips stacked on top of the other. And then you're just going to lift this leg straight up to the sky. And with this, we're trying to get 30 to 50 degrees. So all the way up would be 90. So trying to find somewhere in the middle of that for our left leg. In this position, we can look at external rotation of our right leg. So what you're going to do is you're going to bring that right leg all the way up towards your chest so that it's 90 degrees. Lift that left leg up so it's just hovering. Try to keep this knee on the ground and lift up. So again, a lot of the times this is the motion that a lot of people are limited in. We're trying to get sort of 40, 50 degrees here, and then coming back down. And then, so if we flip over to the other side, again, coming all the way onto our side, stacking our hips, trying to lift that leg straight up for abduction, and then bringing this knee towards you, and then lifting that right leg up and trying to come off the ground for external rotation. Then we're going to come onto our backs for extension and internal rotation. So what you're going to do with your yoga block or your towel is you're going to put it in between your knees. have them up at 90 degrees, and you're gonna, we'll do our left leg first. You're gonna try and bring your left leg away from the yoga block. And again, here, this is probably the most limited movement that I see people being limited in. And that's a lot of the times when people get that pinching feeling in their hips is when we're tight in internal rotation. And again, trying that with the right side. And then just to look at our hip extension, we can just do like a single leg bridge. So what you're gonna do is we'll look at our left leg first. You'll hug your right leg in, and you're just gonna try and push through that left leg to lift your kind of bum off the ground. And then again, trying that on the right side. So hug that left leg in and push yourself up. So again, trying to get 30 degrees with that. I find we can also look at that on our stomachs, but a lot of the times, you know, our back starts arching. Other things start to take over, and we don't really get to see true hip extension. So I'm sure based on that, a lot of you sort of felt things that felt, you know, a little tight. You know, one side was moving a lot better than the other. So what we get into next is going to really look at how we can increase that, you know, that range of motion in those areas. So I had mentioned earlier that stuff about FRC. And so in terms of the hips for FRC, we really look at internal and external rotation, because, you know, we see that as the most important movement of our hips. So if you don't have, you know, that close to 40 to 50 degrees of internal or external rotation, then we don't start to move into flexion or extension or the other movements until we've really achieved that rotation that we want, because that's, you know, what our hips are really good at doing. So a lot of the mobility stuff that we're going to get into today is really going to be focusing on increasing that, that rotation of our hips. So the first thing that we're going to get into, they're called controlled articular rotations, or they're called CARs. And again, and these also serve as a little bit of an assessment to see where your hips are at, sort of compare left and right. But they also really turn into a nice treatment tool. Unlike, you know, most exercises where we're like do 3 sets of 10, these are really something that you can do, you know, really often, because every single time that you do this movement, it's kind of like Dr. Gravelle said, getting that synovial fluid, getting that sort of stuff in the hip that gives us good movement. It's providing input to the brain, producing an output. And every time we're getting an output from that, it's all just going to increase our control. And so that's what we said mobility is control and strength. So the more and more we do these, you know, the better control and strength that we're going to get.
So Amanda, sorry to cut you off. Before we get started in that, Dr. Gravelle, do you typically, like, just before people kind of start getting into their own mobility and all these things right now, like typically how receptive are patients, you know, in terms of just actually taking control and identifying, you know, conservative strategies to help their own hips? Or do you find that more people are, you know, wanting to, you know, go the imaging route or figure out other options? And like, what in your practice, what do you normally sort of suggest people do in this situation?
Yeah, I think definitely first, having an assessment is kind of the biggest thing. The assessment just kind of leads us into figuring out, yes, people may come in with like hip pain, but obviously we need to check, as I was describing before, like above and below, is there something else going on, which there typically is. So then from there, yes, if there is like an indication based on the assessment, if I'm thinking that this is some sort of like bony abnormality, definitely just starting off with a set of x-rays is usually the first thing to kind of start with. Then if you're thinking though, if there was like history of some sort of trauma or anything like that, best thing for like soft tissue and kind of looking like within the joint would be like an MRI or an MR arthrogram. But even during that time, there is a wait period most times for these things. Definitely starting out with like physiotherapy. Basically conservative management is usually the kind of creates resolution in most people. Now granted, those that have trauma, there's obviously a little bit different, but those that are just saying that this has kind of come on out of nowhere, that's usually then easily fixed with, and it's not instantaneous. It does take work, no different than anything, but over a few weeks with like physiotherapy and strengthening around kind of those joints. So stretching and strengthening, as Amanda's talking about, usually relieves the pain. Kind of starting off that way is kind of always the place to go. Kind of what Amanda's going through right now is very, very important.
So basically the key takeaway, is really what we're hearing is, don't just wait to sort of figure out what the problem is, start therapy, start getting it to feel better, take action of your own bodies, and obviously guided by, healthcare professionals like yourselves, to really be able to figure it out. Because the reality is too, as a physiotherapist, Amanda, like if you feel that someone's not really able to kind of go through these motions and it's too painful, that's where you'll intervene too and recommend to see Dr. Gravelle for imaging or to kind of follow up with medical intervention. Because a lot of the times patients sometimes do just feel like, oh, I got to wait, I got to figure out what's going on. And then in the reality is you're getting worse, right?
Yeah.
Right. Yeah. And we've definitely like shared patients with hips where like he sent them to me and like he was waiting for imaging, we did great stuff with his hip. He had his imaging, it showed impingement, but we'd already done so much stuff that his hips were feeling a lot better. So we've definitely like built up that partnership with a lot of our active patients.
Yeah. And then just to add on to that, any of my patients who've come to me have kind of heard this spiel before, but what people don't understand is like inflammation. It's a very difficult thing because we use kind of hips, knees all the time. It's something that if that is occurring and that can be chronic, you're not going to get any healing. Just not to get into it too much detail, but kind of just the chemical release that happens with in the inflammatory process, you're not going to get repair. So the whole idea behind a lot of this is kind of stabilize kind of those major joints so you're not getting kind of micro movements from like an abnormal gait or kind of walking improperly. Get that sorted so then you're not kind of furthering the issue or possibly causing issues at other joints.
Amazing. Okay, I won't be a tease. Amanda, take it away. I know everyone's dying to do this with you.
All right. So yeah, this next part's going to be like 12 to 15 minutes. So this is the fun part. So I'm going to get everyone onto your hands and knees.
And everyone listen to her. Get on your hands and knees. Don't be lazy.
Don't be lazy like Sapna.
Hey, I'm moderating. It's different.
All right. So first I'm gonna start with my left hip here. We're gonna do some hip cars. So what I want you to do, you're gonna bring your knee in towards your chest. From there, you're gonna open up sort of like a fire hydrant. You're then gonna try and twist your foot so that it's facing the ground, the ceiling, and then you're gonna bring it around. Try not to rotate through your back too much. Then you're gonna bring it back in. And then we're going to reverse that movement. So you're going to come kind of donkey kick it up, open up that hip, bring it around and in. So that's one. We're going to do one more. So again, bringing your knee in towards your chest, opening it up like a fire hydrant, pointing that foot up towards the ceiling, wrapping it around, coming back in, and kicking it back up, opening up your hip, bringing it around and down.
For everybody that's watching right now, just to comment on you, Amanda, like your lower back is staying stable. That's a really important part, that you're just kind of just using the hip and kind of the muscles around that area, and that you're not kind of swaying too much. Not an easy thing to do.
Thanks. Okay, so now for the right, my right side's not as good as my left. But so again, bringing your knee up and towards your chest, opening up that hip, pointing the foot towards the ceiling, bringing it around, down in towards your chest, and now reversing that, so kicking it straight back up, opening up that hip, bringing it around and down, and then one more time on this right side, so bringing it up and towards your chest, opening it up, swinging that foot around, coming back, and then coming in, and kicking it up towards the sky, opening up the hip, coming around, and then back down. All right, so if we go on to the next, where we see sort of pails and rails, I'll get into what exactly those are once we're holding this stretch. But what I want you guys to do is get into this position that we call 90-90. So we'll start with our left shin in front first. So your left shin is going to be parallel with the mat here, and then your right shin is going to also be parallel just how it is over here with sort of this side of the mat and then both hips at 90 degrees. So right now we're going to be focusing on this left front hip here. So I just want you guys to sort of sink down into a position where you start to sort of feel sort of this band around your front left hip. And we're just going to hold that for a little bit. And so ideally, you know, when we're doing this, we want to do this for like 2 minutes, but for today, we're just going to be holding for 30 seconds. And then we're going to get into something called, that in FRC, we call pails and rails. And that's just a short term for progressive and regressive angular isometric loading. And so all that is just really contracting the joint, the muscles on both sides. So like I talked about with stretching, we're just focusing on one side when we're, you know, holding a pigeon stretch. But with this approach, we're working on both sides of the joint because we want to, again, create that strength. So when I say pails, what that's going to be is you're going to push this left knee and this left ankle so hard into the mat. So hard that if someone, you know, came to lift your leg up, they wouldn't be able to because you're putting all of your force through that ankle and through that left hip. We're going to hold that for 10 seconds. And then when I say rails, you're going to try and lift this left ankle off of the mat. For most of us, it's not going to move a whole ton, but it's just that contraction so that we're going for. So what I'm going to get everyone to do is start to push that left knee, start to push that left foot into the ground as hard as you can for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And now rails. So try to lift this left ankle up off the ground for 5, 4, 3, 2, 1. You know, don't move. You're going to come forward a little bit more. Try to get a deeper stretch into that left hip. We're going to do our pails. So pushing left knee, left ankle in as hard as you can for 10, 9, 8, 7, 6. Push even harder. 4, 3, 2, 1. And now our rails, we're trying to lift this left ankle up off the ground for 5, 4, 3, 2, 1, and come forward a little bit more. And again with our rails, so start to push left knee, left ankle in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift ankle up for 5, 4, 3, 2, 1. So with some of these movements, you might sort of feel like your leg's falling asleep just because, you know, your hips aren't used to being in these positions. As long as it's not painful, you know, as long as you don't have any sort of pre-existing really serious condition, that's okay. Just listen to your bodies. Now we're going to focus on this right back hip. So staying in the same position that you are in, you're going to lean back. So if your left foot's forward, you're going to lean back a little bit so that you're starting to feel it in that right hip in the back. We're just going to sort of hold this position here. You know, another reason why pails and rails or what we're doing right now is so beneficial is because our muscles and things aren't actually moving. It's what we call an isometric contraction. They're a lot safer than, you know, say doing a bicep curl like this because it's not moving. So every single time that we do it, it's again providing input to the brain. The brain feels like it's safe and, you know, that it can do it, and then it lets us kind of push it a little bit further each time we're doing it. So now from here, our pail is going to be our right foot and our right knee pushing into the mat, and our rail is going to be coming to pull that right ankle off the ground. So we're going to start doing that now. So start pushing your right knee, right ankle into the ground for 10, 9, 8. Keep that left knee down though. 7, 6, 5, 4, 3, 2, 1. Try to peel that right ankle off the ground for 5, 4, 3, 2, 1. Now you're going to try to lean back a little bit more. Start to push that right knee, right ankle in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift for 5, 4, 3, 2, 1, and try to come back a little bit further. Last one on this right leg. Push that right knee, right ankle in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift for 5, 4, 3, 2, 1. Okay, we're gonna switch positions, but I want you guys to try to do it without letting that right leg come towards the ground. So you're gonna try and lift, try and swing that leg back without it touching the ground. So now we have our right leg in front and our left leg behind, and we're just gonna go through 3 sets on each side again that way. So sort of leaning forward enough so that you start to feel that stretch in that right hip. And then we're gonna start with our pail. So this time, right ankle, right knee are driving into the ground. So as hard as you can for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then lift that right ankle up for 5, 4, 3, 2, 1, and try to come a little bit further forward. Push everything into the ground for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift for 5, 4, 3, 2, 1. Come forward a little bit more if you can. Last one on this right leg. Push knee, push ankle in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift for 5, 4, 3, 2, 1. Okay, now coming into this back left hip, you're going to be leaning a little bit back into the right. Still try to keep this right knee down though. And then now our pail is going to be our left knee, left ankle digging into the ground. Our rail is going to be trying to lift that left ankle up. So we're going to start to push as hard as we can with that left knee and ankle for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift for 5, 4, 3, 2, 1. Try to come back a little bit further. Start to push for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift for 5, 4, 3, 2, 1. And last one on this left leg. Come back a little bit further. Push left knee, push left ankle in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and lift for 5, 4, 3, 2, 1. All right. So now, next exercise we're going to go through, you're going to sit sort of what we call like a bear sit, legs apart, and then our hands are going to be on the on the insides of our legs. We're going to do both legs at the same time here. So again, the legs shouldn't be moving a ton, the arms shouldn't be moving. It's an isometric contraction. So what you're going to be doing when I say pails is you're going to be pushing your knees into your elbows as hard as you can for 10 seconds. When I say rails, you're going to try and peel your legs off of your elbows, and we're going to sort of create a new barrier each time and push into that. So again, sort of push your legs out as far as you can and then get your elbows to the insides of your legs. And then we're gonna do our pail. So push into your elbows for 10, 9, 8, as hard as you can, 6, 5, 4, 3, 2, 1, and peel your knees away from your elbows for 5, 4, 3, 2, 1, and then elbows bring them to where your knees are now and push in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then peel away again for 5, 4, 3, 2, 1, and then last one here. Bring your elbows towards your knees and push for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and peel away for 5, 4, 3, 2, 1. Good. Now we're going to go the other direction. We're just going to do one leg at a time. So what I want you to do is make sure both your sort of sit bones are both on the floor, but you're going to try and bring one knee in as close to the ground as you can with still. So we'll start with our right, but still keep that, right glute on the ground. This time your hand or your elbow is going to go on the side of your right knee. And this time our pail is going to be pushing into our hand on the outside, and our rail is going to be trying to get a little bit closer to the ground. So for our pail, we're going to push onto the outside of our hand for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Try and bring your knee a little bit closer to the ground for 5, 4, 3, 2, 1. Again, push into your hand for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and bring it a little bit closer to the ground for 5, 4, 3, 2, 1. And then last one on this right leg, push into your hand for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and pull it away for 5, 4, 3, 2, 1. And let's do this left leg. So again, trying to get it to fall towards the mat as much as you can. Left hand on outside of that left knee, pushing in for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and pushing towards the ground for 5, 4, 3, 2, 1. Pushing into your hand for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then pushing to the ground for 5, 4, 3, 2, 1. And the last one here, push into your hand for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Push into the ground for 5, 4, 3, 2, 1. And just sort of shake it out. So we're going to do one more exercise. So what I want you guys to do, if you're able to have your back all the way against a wall or a door or something, bring your yoga block or your towel. And all we want is, so we'll start with our left leg straight out. Right leg's the foot's gonna be flat against the wall or parallel to the wall, so that you're sort of in this position at 45 degrees. And all you're trying to do, keep your back straight against the wall, sort of try to keep your bum towards the wall, and you're just gonna open up this right hip. The goal is to get it all the way towards the wall. A lot of us are, might be stopped somewhere in the middle here, might be even lower, but just sort of find that range that's comfortable. And we're just gonna do 10 sort of openings there. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're gonna let your knee relax, staying in that position too. You're gonna grab your yoga block or your towel. I want you to put it on the inside of your foot. So here we're gonna be working on a little bit of flexion, and so we call these hovers. So it seems like it's gonna be really easy, but a lot of people have a tough time with it. So what you're gonna try and do is you can have your hands on the ground. You're gonna try and really control your foot over that block. Come down. Again, back over, down. If you're not able to get it all the way over the block, even just try lifting it and coming straight back down. Let's do 3 more of those. Good, back over. And last one. All right, and then let's switch legs. So right leg's gonna be straight out, left one's gonna be against the wall at 45 degrees. And just trying to open up that hip. 10, 9, 8, 7. Good, you might be getting some cracking and clicking. As long as it's not painful, it's okay. 5, 4, 3, 2, and last one, and 1. Gonna grab your yoga block, keep your foot in that same position, and trying to get over. Don't let your foot sort of, stomp down. You really want to control it over. And as you bring it down, let's do 2 more, and 1. All right. So just even in that PowerPoint slide, I have like a ton for each direction.
The exercises related to the hip flexion, or should they still do a full series?
So again, sort of what we learn is like hip flexion is sort of last. So even though you have tight hip flexors, it's still going to be the most beneficial to work on the rotational aspect first. Even in terms of this, like there are what we did with pails and rails for the hip flexor, but still you wouldn't get into those until your rotation is good. But definitely, like if I was to put a program in for you, like definitely would still include the hip flexors in it, but it would never just be like just hip flexors, but you still want to get a little bit of it in there.
Here's a really good question. So for someone who can't go on the floor as readily as we just all did with you right now, do you have any recommendations for modified versions like on a chair?
Oh yeah, of course. Like there's a million ways to do all of these exercises. Like even the cars that we did in the beginning, a lot of times I do them in standing too. So yeah, it's just about making it personalized to everyone. And there's definitely everything here can be done in a chair, can be done in standing, can be done lying on your back. It's really just about once you kind of understand the movement that you're supposed to be doing, as long as you can really do it in any position. And like I'll have I have no problem sending you an email of modifications of how you can do them in the chair.
Oh, amazing. And then and we will be giving you Amanda's contact in just a sec. So now in terms of finding, like if someone's finding it hard to do the series that you just did right now, and I mean, some of us were out of breath from that. So would you say that like, just keep doing it and you'll get better? Would you say start with maybe like doing only half of the time or duration that you recommended and build your way back up? Like what would be your suggestion for people who are starting it and realizing they just got winded?
So definitely starting with like the cars that we did. So like even just doing three of those forwards and backwards, and not even really getting into like the contraction aspect of it. And like I think you could very easily just take like 1 or 2. Usually I only give like for people who aren't like super enthusiastic about exercise, and just even giving them 1 or 2 of them and getting them to get really really good at them. And again, like you had mentioned, like people get better at these really, really quickly. So it's like very often that I give some of them, and then the next week they're like, oh, look how close I can, get my leg up to the wall. And it's like, it's a challenge for them to do it. They're like, oh, it's not supposed to, go up that high. And then like I do them, and I'm like, yeah, it is.
But it's such a confidence booster too, right? I feel like when you start to see your body move in new ways, it's like people who start taking yoga and they're like, oh, I wasn't bendy, and now all of a sudden I am. I have a question for Dr. G. Are you still there?
I am still here.
Awesome.
I was going to comment as well on what Amanda was just saying. Also, just realize that although this is just kind of just against gravity and using your own body weight, you can expect to have some pain. I have patients that will come in saying, hey, I'm actually quite a bit of pain after these things. We are kind of working muscles that are typically not used. So very, very common for that to happen, to have a little bit of soreness, kind of 1 to 2 days. So typically around 48 hours, which is called delayed onset muscle soreness. So definitely a common thing.
Right. And someone actually asked a really good question. So if they're in a lot of pain right now, but they still want to be moving, because like we talked about, lotion is motion. What are your perspectives and thoughts on anti-inflammatory medications, over-the-counter Voltaren, all that stuff? Like, is that something that they can kind of continue with while continuing? Because we really, I mean, I know Amanda and I were big proponents of incorporating mobility right from the onset of an injury. But from your perspective, is it safe to take? Like, would you recommend that they still take it, or like where's your kind of guideline on that?
Yeah, obviously before you take anything, and that's like over the counter medications, supplements, anything, always check with your doctor first. Just because it's over the counter does not mean that it's harmless. In terms of everything, I find that people don't use ice actually enough. They don't take enough into that. So the hip is actually one, though sometimes pretty difficult one to apply ice to. Ice can't penetrate down into the hip joint as much, but definitely for like lower back, knees, things like that. That's a first place to start. 20 minutes on, 20 minutes off. Repeat that 3 times. Never directly on the skin. Always put like a tea towel or something between the skin and the ice. In terms of anti-inflammatories, so yeah, you have your starting off point is ibuprofen. To anyone here, that would usually be like Advil. The next step up that's over the counter would be naproxen. It is stronger, so that would be like Aleve. Those are basically just the medical or kind of pharmacological way of reducing inflammation. But again, like ice does the same thing. And sometimes you require those initially to help you get through some of this. So if you were going for a session with Amanda, maybe initially, yeah, you are in quite a bit of pain and we're kind of maybe restarting the inflammatory process, but over time that will go away, and these definitely are safe as long as you don't have any like comorbidities or anything going on. Perfectly safe to take in short amounts. Also safe to take with Tylenol as well. Those two, people get that mixed up, that they can't take those two together, but that is perfectly safe to take together and can help out as well.
Awesome. And you know what I love too about Amanda, what you just taught, like none of this is something that you would typically see on like, you know, YouTube or like the internet. Like these are such interesting, you know, approaches. And what I really like, it's not cookie cutter. It's so individualistic. And so, okay. So everyone's asking, okay, where can they reach you? So is there a slide, Jocelyn, on her contact info? Oh yes. Oh my gosh, look at this. Okay. So Jocelyn, go ahead and just kind of take your mouse and circle over her email there. So I know some of you have had some questions about specifically modifications. So I think in this situation, we will still reach out to you, of course, with her contact details. So you don't have to write it down right away. But Amanda Lee, we have a few people with the name Amanda, Andrea, and Lee. So we do want to make sure that you guys catch that it's A.M. Lee. If not, the other A. Lee will forward the emails over. You want to make sure you send it to the right one. So yeah, if you had any questions about this, Amanda will still definitely you know, be able to sort of give you modifications. And what's really awesome too, if there's something that you're not sure about, Amanda's also giving some complimentary virtual sessions. So if you have some additional questions, you just want to kind of like go over a couple of extra things that you maybe didn't get from today's webinar. I know we had a couple more questions we didn't get to in the essence of time. Feel free, like if I think we go to the next slide, there is a virtual platform. So if you go on to our online, you can even just go to our website first, and then you can find our all of our wellness and rehab services have a booking link. If you scroll and you find Amanda's picture, you'll be able to see all the things that she's doing. And honestly, she's open, she's available, she's more than happy to take any questions. So feel free, you know, you can even show her a couple of the exercises that you just went through. And if she thinks that you need a proper guided one-on-one program, that's where maybe you guys can have that conversation with her. But if for now you just have a couple more questions, do not hesitate to reach out to her. Also, Dr. Gravelle is doing walk-in services as well as tele-family medicine and just medical consults in general. So again, if you guys have more, you know, questions that you want to ask, I know during this time it's kind of tricky, like, do you even go and get imaging right now? Like, what if there's trauma associated and you don't know how to manage your pain or your condition fully? You know, again, that is something that he will be able to educate you on. And if it was someone that was truly in a lot of pain or emergent, Amanda will make herself available on a case-by-case basis to see you in the clinic. That is something that our college and the ministry is still allowing, but we just want to make sure that if we can help you virtually first, we're going to try our best to do that. And in terms of upcoming webinars, we have a couple more exciting ones that I'm excited to talk about. So tomorrow we have pelvic health explained and the impact of social distancing, because so many people don't realize what is happening with their pelvic health right now. And again, tying in hips, like Amanda, isn't that huge? Like pelvic floor health hips. Like, we like to tie in themes. So this is a great segue. And also, you know, we do have Dr. Kegel, who may or may not be talking about Kegels. So definitely a really exciting one. They're going to be touching on male pelvic health, female pelvic health. It's going to be wild. It's going to be a really good experience. I already went through their walkthrough. It's so eye-opening. So definitely register for that if you found today's informative, because they're both linked and they both go hand in hand. And then on Friday, our techie here on the back end, who she probably won't reveal her face right now, Jocelyn, is actually the person behind that logo that you guys are seeing. That's her beautiful face. Jocelyn is also an RMT, for those of you who don't know. So she doesn't just work in our management team. She is actually a registered massage therapist, a very unique functional massage therapist in terms of, you know, what you would expect in her clinical practice. So if any of you have actually had a massage from her, you'll know she's very similar to Amanda. You know, if you go in telling her that you have neck pain, she is finding that issue on your opposite hip and working through your knee. So super exciting. Jocelyn, did you want to say a couple of words about your workshop this Friday?
It's, you know, a lot of the times, again, kind of like how Sapna said, a lot of times when patients come in saying that they have neck pain, headaches, and a lot of times I'm like, it's coming from your hip. So it's kind of, you know, I have a very holistic and universal way of looking at the body. So, and a big part of it are trigger points and referral pains. So hopefully we can sort of minimize some of those pain points for you guys.
Amazing. So that's on Friday. So guys, keep tuning into our webinars. If you register, you do get the recordings. So this will all be made available to you. If you don't register, it's more difficult to get the recordings. You're going to have to kind of wait for us to send to you, because the way that we format the recordings and send them out. So definitely register. There's no harm. We don't take it personally if you don't show up. And also the pathways of pain. Did we figure out, we have a physician joining on that one too, don't we?
Yeah, we have Dr. Amy.
Oh, that's going to be exciting. And for those of you who don't know, Dr. Amy and Dr. Braden are married. So that's going to be a fun one. So they're both kind of taking on all these cool MSK webinars as well. They're both a pool of knowledge. So we're super excited. Our team is so diverse. Our team is so talented. And honestly, our biggest takeaway from everything with our webinars, like I keep saying to those of you who attended all of them so far, thank you. We are so overwhelmed by your commitment to and your loyalty to our clinic and to our overall, you know, mission right now to educate you guys. These are tough times for all of us. So, you know, we just feel so welcomed by the community right now. It means so much to us that you're even attending. We really do feel sort of like, you know, famous. We're like, oh, we have people actually wanting to learn and listen. This is amazing. So anything else that we missed, honestly, send us an email. We still have all of our admin working virtually. So give them a call. Do not hesitate. And honestly, make sure in these troubling times, you don't forget your health. So call us if you have any health needs. We're here for you. Dr. Gravelle, thank you so much. Amanda, thank you so much. That was amazing. Both of you guys enjoy your day, okay?
Thank you.